Thank you for taking the time out of this busy week as we prepare for Thanksgiving by joining us for our Hormone Happy Hour on weight loss and hormones. As many of you know who we are, for those of you that don't, we are a
You're welcome.
HRT, a hormone replacement therapy clinic in Bluffton, South Carolina. And we specialize in hormone replacement and integrative health. We are now at our 6 months into our journey, and we're so very thankful for all our existing patients and our new patients to come. We've have a lot to offer and plan on having a wonderful 2023 by helping you feel better. I'm Nicole, and my contact will be given to you at the end of the presentation. I'm happy to get you scheduled and answer any questions you may have in regards to all of the services that we offer. We also will attempt to answer all of your questions during this seminar if time allots for us. If you can please just be generic. And as a reminder, we just cannot give any medical advice on this platform. If you have questions you would like to ask me privately, you can email me and I will do my best to help you with those. But at this time, I want to turn the floor over to Erin. She is our provider and our owner. So thanks again, everybody, and thank you, Erin.
Thanks, guys. And I apologize if I clear my throat. There seems to be something stuck in it, so that's just perfect timing. So this topic I feel is really timely for multiple reasons. There's a lot of new buzz about weight loss and some of the new type of treatments coming out for it. But I think weight loss is one of the most complex things out there. It is not just as simple as giving a drug or putting someone on hormones. And that's why you see this title here: weight loss toxins, your hormones, and new options. So, we're going to kind of talk into all of it. And pardon me if I interrupt here, I'm kind of letting people in as I talk as well. So, some of our objectives, and it will be recorded. So we will send you guys the recording for those of you that are here and anyone that signed up that couldn't be here. So we're going to go through, and I'm going to try to be not super wordy, I promise. Sometimes I get a little, out of hand. And just make sure as you come in, you mute yourselves. I'll try to mute you guys too. So we're going to talk about toxins and their relation to weight loss, because this is very important. And we'll discuss why. We're going to talk about hormones and weight loss and some particular hormones that need to be imbalanced when it comes to weight. The importance of thyroid balancing, the impact of stress on weight loss. We all are feeling this lately and just in general. If you say you don't have stress, then you just are not aware of it, and I'll help you point it out. That's a good one thing I'm really good at. The importance of blood sugar balancing, and then new options for weight loss that we'll discuss as well. Okay, so let's talk about why toxins. So, this is one of the most important things that we really have to address. Each year, we, as an average person, are exposed to about 14 pounds of pesticides, herbicides, and food additives, as well as preservatives. This is things that we're ingesting in our environment, and it's really quite hard to avoid these regardless of how healthy you eat. We inhale over 500 environmental chemicals a day in our home. And the problem is, our body has the capability to handle a certain amount of toxins before it becomes overwhelmed. Right. And so we have this innate ability to cleanse and to heal. But once we become overwhelmed, it really throws the body off balance, particularly the liver. And we start to see changes in our hormones, in our weight, amongst other symptoms that we start to experience. So how do they affect our body? Well, our gastrointestinal system, we know a lot about this, right? We hear a lot about gut health. It's important for not only breaking down, assimilating, absorbing our food, but it also helps us eliminate toxins, right? And what people don't realize is part of our gastrointestinal system is actually the liver. The liver and the gut are directly connected. And the liver plays one of the most important roles in detoxification, especially when it comes to our hormones. So it helps remove toxins from the foods that we eat and helps with a lot of metabolic processes. The GI system, or the gut, and the liver are directly related in the sense where the liver helps us stimulate bile to be secreted, which then tells the stomach, hey, let's make hydrochloric acid and digestive enzymes, which are essential for breaking down our nutrients. So, a lot of us that have a backed up liver, we're not getting that part of our gut going, and then we're having gut issues, which is kind of throwing everything else off. So, on a day to day basis, just in general, the amount of toxins that the liver has to field is a lot, right? And then if we have a backed up GI system, that puts a lot of strain on the liver. And our ability to eliminate these toxins normally is impeded. And so we start to get this toxic overload and burden. And this greatly affects our ability to make hormones, neurotransmitters. Neurotransmitters are a lot of those chemicals in the brain that make us feel happy. So we start to get symptoms of depression and anxiety. The list goes on. And we're going to discuss some of those symptoms as we move forward. So the liver has a big job to do. And we make it really difficult with all the things we put into our body on a day to day basis, right? So, you probably have heard this scenario, and I like to show this picture here. So, our body is really smart, right? We, if we have toxins in our body will create fat to shield us from those impurities, as you see here. And as you see here, when we have excess fat, those toxins are kind of like nicely spread out. They're just hanging out. They're not kind of really tight or tense in there. And it's a little bit more evenly distributed. Then what happens is, regardless of what diet we try, if we're using a fat or what, we're losing fat at a rapid rate. And we kind of come over to this shape here. So now all those nice toxins, they're really condensed, and they're really dense in the body, and that feels really bad for our cells. So what does our body do to shield us? Well, it gains the weight right back. And I hear it a lot in men and women. I lost 20 pounds and I gained it right back. Well, it's because we never really detoxified our body. And so our body didn't know the difference and we gained it right back. So we have to make sure we are detoxifying, we're purifying the body, we're getting our body ready to lose weight and sustain weight loss, right? Because that's what we all want. We don't want a quick fix that we're just going to gain it right back. We want sustained weight loss. And true detoxification leads to that. So I like this picture because it really shows kind of what happens if we don't go through the proper channels before we're ready to lose weight. The role of the liver. So we talked about the liver and its role in detoxification. Well, it is a two-step process when we talk about detoxifying the liver. The first is the liver takes our different things that are coming into our body through enzymatic process, and it makes them like these water soluble intermediate metabolites, right? So think of making them like water. So these are actually more toxic than the original toxin, which is why we have to go through phase one and phase two. And a lot of people, or a lot of different detoxes out there that you see, or medications out there that you see, or supplements are only addressing one of the phases. So it's really important that we make things water soluble. And then in phase two, we push that out the body. Right. So if you think of a juice detox, that's changing everything to phase one first, but it's doing nothing to open up those pathways. So everyone's like, I feel so awful. I had to stop after a couple of days. Right, because all those toxins in you that are more toxic, they're concentrating and there's no way to get them out. So phase two is all about pushing things out of the body and making sure that the gut is healthy so that we can further eliminate that through our stool and our urine, sweat through our skin as well. Right. So all of these things matter. So sorry, that's a little bit blurry, but this is kind of showing us a little bit about each phase and what nutrients are needed. So we have all of these pollutants and toxins that come in during phase one. We need a lot of these nutrients that are depleted for many different reasons. B vitamins and folate are typically depleted because of stress. And so a lot of us are deficient in them. And they play a role in a lot of important cofactors in the body in general, including our hormones. Vitamin D is one of the most deficient hormones that I see. Vitamin D is actually a hormone, and most people do not have enough. And whether we're taking one or not, typically we're not taking the right kind. We have to make sure that we're taking a vitamin D3 with K2 because D pulls calcium from the stomach, but K puts it into our bones. So all these different things are important. Antioxidants, milk thistle helps support the liver. So all of these nutrients are needed to help with phase one. And then phase two, we need different types of factors like amino acids, glycine, taurine. All of these different things are going to help push them out of the body. And then lastly, you see here, sorry, my little window is in the way. I don't know if I can move that. Okay, yes. So you see here, we got the gallbladder that is going to stimulate bile. That is going to help the bowels move a little bit more, create hydrochloric acid, get things moving. And then the kidneys will help us detoxify through our urine. Right. So, one of the first things we do, if you are my patient, you're probably like, oh my God, I hate this girl because she already put me on this. So, this is one of the first things I do with every single one of my patients, whether you're trying to lose weight or not. And the reason why is because our hormones are um, the liver is like 100% responsible for detoxifying our hormones. So there's a lot of medications that we are placed on that put a huge burden on the liver, whether we've done hormonal birth control that really strains the liver. But we need to get the body ready to accept hormones, and we also need to get the body ready to eliminate toxins and lose weight. So this is a super easy program. It's a 7-day program. It's medically guided, so it's going to focus on phase one and phase two. The nice part is this actually opens up our pathways in phase two first and then changes them to water. So we have less of that yucky feeling that we sometimes get through detoxes. So all of those nutrients that we just talked about are all in this program. It's a shake twice a day and then the supplements twice a day. So this is a great way to get started. Again, something that we give to most of our patients. But if you ever wanted to try this yourself, that is something that we have available at the office too. And this really gets the ball rolling with unmasking some of the other GI symptoms that you may have going on, which is really nice because we want to make sure that the gut is properly working as well. So now what? We detoxified, right? We got the body ready. Now what do we do? So there are a lot of different things that need to be working in harmony in order for us to lose weight. And we're going to discuss a little bit about each of these. So hormones, our adrenal glands or stress management, the thyroid gland, and insulin resistance. So we're going to talk all about these. So what are hormones? Well, this is the bread and butter of what we do at our clinic is hormone replacement therapy. And if you think about your hormones as little text messengers, they're like little messengers that you send a text, hey, go get milk, and your husband goes and gets milk and brings it back, right? These are chemical messengers that are sending messages to different glands in the body and telling them to do different things. So they have receptors throughout the entire body, and this is our communication system for creating responses that we want in the body. They affect everything from our nervous system, our GI system, our cardiovascular, our immune health, and just as you know, when hormones are in balance, our overall sense of well being. So, this is a perfect analogy. It's like the Christmas lights, right? When one's out, they all go out. So, they have to be in perfect harmony. And if one is out, it really begins to wreak havoc on the entire body. So, what are some symptoms of imbalances? Well, it really depends on which individual hormone is imbalanced. And the difficult part about hormones is that a lot of these symptoms mimic each other. So, it's really important to discuss with someone that really understands hormones. But these are some of the symptoms. So, the biggest thing I see in my clinic is fatigue. Even with a good night's sleep, still just feeling tired, specifically in the afternoon. Insomnia, of course, is a big one. Weight gain is obviously one of the biggest complaints I see, and it's more of a redistribution of weight, right? It's starting to hang around the abdomen or the outer bra roll or the thighs, right? It likes to hang out all those fun places that we don't like. Chronic pain, we can actually develop joint pain from hormone imbalances. Hair loss, that's a big one. Hair thinning, hair breaking, just feeling more dry than normal. Unexplained headaches. This can be for women that are cycling or not cycling. Men too can get headaches. Mood swings, depression, anxiety, hot flashes, night sweats. A big one is decreased sex drive or lack of sex drive at all. Of course, weight gain, digestive disorders, acne. This one's really big, and sometimes people don't even realize this, but just like a lack of enjoyment or just feeling like no matter what's going on, you're just not happy anymore, right? Brain fog, just feeling like you have this fog over you. You can't concentrate. You can't think sharp and quickly like you used to. And then, of course, inability to gain muscle strength or mass and issues with our cardiovascular system like blood pressure. So, a lot of different wider ranges. I only covered these, there's so many more, but a lot of different symptoms can happen. So, one thing that patients don't realize is how important hormones are for our weight and why sometimes this starts to change as women get towards perimenopause and menopause, and as men get older too. So, testosterone is one of the least talked about hormones in women, and it's one of the most important. Of course, we know how important it is in men. So we all talk about it there, right? And it's primarily made in the ovaries for women and the testes for men, right? So for men, after the age of 30, it decreases about 10% each decade, right? So by the time you get to this, your 50s, 60s, you're probably feeling those effects. Now, as we as you're going to see, or as we talked about, toxins can affect this for both patients. So that can drop off those levels of testosterone even sooner for men. Women, this is often one of the very first hormones we see drop off, and they see that. They see those changes in weight, they see the decrease in sex drive, they see the fatigue happening, and we're just given estrogen and progesterone, and we're wondering why we don't lose weight. Well, this is why. So, testosterone helps the body's tissues take up more glucose into in response to insulin. It also is positively correlated with insulin sensitivity. So your ability to be sensitized to insulin and use it appropriately. So without testosterone, we're not pushing our testosterone or our glucose. Sorry, apologize. Our glucose into the muscle, right? So it's kind of hanging around. Let me just take care of this real quick. Sorry, that was driving me nuts. Okay. It's kind of just hanging around the glucose, and we're going to talk about this a little bit more in the insulin resistance. So testosterone pushes glucose into the muscle. Very, very important. It improves our glycemic control, insulin resistance. We see decreased cholesterol actually, and visceral adiposity. So that thick visceral fat that's in the abdomen that predisposes us to metabolic syndrome. So we actually see overall reduction in cardiovascular risk with healthy levels of testosterone. And it's been proven time and time again in many different studies. So very important. Estrogen too is super important for women. So, this may start to drop off for many different reasons. Women can have premature ovarian failure in their 30s. It can start to drop off in our 40s with perimenopause and then menopause. Estrogen actually increases a woman's resting metabolic rate. So, your ability to burn weight while you're sitting here, burn fat while you're sitting here listening to me, that is your resting metabolic rate. And estrogen actually increases this. When we have low levels of estrogen, this obviously is going to contribute to weight gain. So, lack of estrogen causes the body to use starches and our blood sugar less effectively. So, we're going to be more sensitive to carbohydrates. And I hear it a lot in women, and it's just very much not true scientifically. Is women are like, I can't eat any carbohydrates. That shouldn't be the case. We should be able to eat these foods that are so nourishing for the microbiome. But the reason is because our hormones are off and we're not using them appropriately, right? So we have decreased insulin sensitivity. We have increased fat storage, and it makes it harder for us to lose weight. I hear it all the time in women. I'm gaining weight. It's sitting like a tire around my waist. I work out all the time. I'm eating right and I can't lose it. Well, you're not alone. This is a lot of women out there, and they're all experiencing the same thing, and this is why. So again, estrogen is made primarily by the ovaries prior to menopause. After menopause, if the adrenal glands are healthy, they will kick in some, about maybe 15 to 20%. So not every woman drops their levels of estrogen, but the majority do. So it just is very patient specific. Okay, this is probably one of the most important parts of weight loss. And one of the things I hear women all the time hoping is the issue. And sometimes I hate to tell them it's not. But I do think the thyroid is one of the most poorly treated and most misdiagnosed condition out there. So the thyroid, as you see over here in this picture, it's a little butterfly shaped gland that sits kind of in the lower part of the neck. And it is essentially our metabolic center. So it helps us with our metabolism. It helps us maintain our temperature. And if it is working too slowly, this is called hypothyroidism, right? So a slow functioning thyroid. And we actually have, like we talked about before, a decreased BMR or basal metabolic rate with a a functioning thyroid. So some of my patients, I have them do fertility awareness method where they're tracking their temperature every day to tell when they're ovulating because your temperature goes up after you ovulate. So I actually utilize this in patients too to see if maybe they have a thyroid issue. Before you get up every morning, you can take your temperature. It really shouldn't, some of these patients with hypothyroidism, it's about 95 to 96. It really shouldn't be that low, right? We really shouldn't, unless we're in the beginning phases, our cycle be below about 70, 97.9. It should be more closer to 98. So if you have a very low temperature, 95 to 96 all the time, your thyroid may be functioning a little bit slower. Another sign too that you can look for too is a very low heart rate, not related to doing a lot of cardiovascular exercise or being a runner, or a very low blood pressure. Those are all things that you can see that may be due to your thyroid. Some other things too, and hair loss is quite a complicated topic and probably for another day, but hair thinning, hair breaking, lateral two-thirds of your eyebrows falling off, that is specific to the thyroid. And then other issues with constipation. So those are all things that may trigger you to think there might be an issue. Now, some of the problems that I see are that we do an incomplete profile when we test the thyroid. So I hear all the times in patients, oh, my thyroid's fine. I just had it tested. And all they have is a TSH and a free T4. That really tells us nothing about the functionality of your thyroid. It just tells me, can your thyroid make thyroid hormone? But it's not telling me, are you converting it to free or active thyroid hormone? Do you have any antibodies against your thyroid? Is there anything binding up your thyroid hormone due to stress, right? And all these things matter because the way Hashimoto's, which is the most common cause of hypothyroidism, is treated is very different than hypothyroidism, right? So incomplete profiles, it leads to a lot of misdiagnosis of thyroid or just poorly treated thyroid hormone with things like T4 only, which is Synthroid. So if you're treated with thyroid right now and you're on T4 only or Synthroid, it is a great idea to get a free T3 level to see if you're making enough active thyroid hormone, because 9 times out of 10, we're not. And we're missing the mark with this important function when it comes to weight loss. So thyroid gland, very, very important as well. This is probably one of the most important things that we often neglect, and that's the impact of stress on our health. So, what is stress? Well, cortisol is made by the adrenal glands. The adrenal glands are two little glands that sit on top of the kidneys, and we make cortisol in response to stress. So, the most important thing I like to help patients identify is where the stress is coming from, because a lot of people are like, I don't have a very stressful life. Well, let me tell you, you have some form of stress in there. And stress comes in the form of toxins, right? Some of the foods that we eat, inflammatory foods. It can be that you're drinking water that is very dirty. Our water system is filled with fluoride. That is a stressor on the body, especially the thyroid. Some of the skincare products we put in, those are endocrine disruptors that can be a stressor. All these yummy candles that we are burning right now, that's a toxin. So environmental toxins, it can be perceived stress. So you have a big presentation coming up and you're just thinking of all the things that can go wrong. Those are stressors on the body and that raises cortisol level, right? So there's a lot of different things out there that can cause raises in cortisol level. It is not just your job or your home life or marriage or kids. It is everything that we're exposed to on a daily basis. So what happens when we have elevated levels of cortisol? Well, it depletes progesterone, right? And we know that progesterone is helpful in balancing out estrogen. So this can lead to estrogen dominance. Estrogen dominance contributes to insulin resistance, and then we get excess fat cells, specifically in the abdomen. It also blocks testosterone production and it competes for that receptor site. So, if you have high levels of stress and you're on testosterone therapy, it probably is not going to work as efficiently as it should. And your, provider may be running into the place where they're increasing your dose, and it's not working the way it should. And it's because that stress has to be addressed in order for that receptor to free up. It leads to insulin resistance. It increases aromatase. So, this is really important for men because a lot of times men will take their testosterone, their healthy levels, and they'll convert it over to estradiol, especially when they have excess fat. Right. And so we don't want that for men. We want some estrogen, but not a lot. And so all that good, healthy, active testosterone is being converted over. For the thyroid, it blocks the conversion of T4 to T3. So T4 is what our body makes on its own. T3 is our actually active thyroid hormone that is going to give you benefits in the body. And so it blocks this conversion. And then lastly, it just wreaks havoc on everything. It decreases our steroid production and decreases the ability of our of us to absorb hormones. So stress, this is only like a fourth of it. This is really more specific to weight loss, but it can affect our cardiovascular system, our respiratory system. The list goes on and on. So we have to figure out what is going on with the adrenal glands. Is our cortisol high or low? And then treat it appropriately in order to get, sustainable results and lasting weight loss. Okay. So this is probably one of the most important things we're going to talk about, and this is insulin resistance, right? And what this means is insulin is our is a storage hormone for glucose. So it allows us to take the glucose that is made or sugar that's made from food and push it into the cell for storage for later. So if we don't eat for a little bit, the body can pull from that storage and survive, right? So when we're not appropriately using this function, we start to get overflow in our system. So I think the most easy way to explain insulin resistance is this time of year, like a FedEx package, right? And if you think about our insulin is the FedEx driver. Or the delivery guy, and our glucose is the package. So we're trying to deliver that package to the mailbox, right? And when the mailbox isn't full, it accepts it, and we take the package out later when we're ready, right? What happens is when that mailbox gets full or that receptor gets full with glucose, it overflows, right? We can no longer fit that in the mailbox. And this is what happens with insulin. The glucose is getting full in the cell because we're not appropriately, because we're eating too much glucose or our body's not utilizing it appropriately. And then we get excess glucose in our system. Insulin will no longer fit into the cell. And so we start to get that spilling over into our blood too. And what happens with that is we get high levels of glucose, we get high levels of insulin that attracts fat cells, and they are specific to the abdomen, the outer thighs, and the bra roll. So that's where we see it in women. So it is a function of our insulin. It's not that we can't make it, it's that we can't use it appropriately anymore. And now we have an overflow in our system. And so this is what needs to be addressed. And this can easily be done by diet. And when that's not enough, we're going to talk about the other things that we can do for that. So, what does this affect? Well, our metabolic health, of course. So, metabolic syndrome is a group of metabolic abnormalities and disorders that are characterized by any of the three of the following. So, this could be a larger waistline, greater than 40, greater than in men, and greater than 35 in women. Elevated triglycerides. So, triglycerides are a part of your cholesterol. Basically, if you have anything fat, fried, or fun in the last week or so, it might show up on your cholesterol report, right? So anything over 150 is considered pretty high. I personally like it less than 100, but I'm a little bit of a tightwad when it comes to the our cholesterol. I like it very tight range. You can have reduced HDL. So when we think of HDL, we think that's our healthy cholesterol, right? So anything less than 40 in men and less than 50 in women. We really want those levels to be higher to give us cardiovascular protection. And elevated fasting blood glucose. Again, this is a snapshot. Our fasting blood glucose is just telling us what's happening one day. We really want to look at our insulin fasting in our hemoglobin A1C, which is an average of blood glucose over 3 months. But that can be classified as an indication of metabolic syndrome. Elevated blood pressure over 130 over 85. All of these things are putting you at a greater risk for cardiovascular disease and type 2 diabetes, right? And we know that the number one cause of mortality in women is cardiovascular disease. So this is so, so, so important. And, a lot of these things are modifiable, which is good news, which is why you're all here on this call today, right? So, some things we can do is eating to support our blood sugar. So, what I hear all the time, more so in women, is that we are not eating enough, right? We're having one meal a day, and that's really setting us up for just a disaster, right? We have
Mhm.
imbalanced moods, we have low energy, we're craving things, and then we binge later. So, really, to set your insulin response, that happens in the morning, first thing in the morning. So, within 90 minutes to an hour, well, an hour to 90 minutes of waking up, you want to have a high protein breakfast, at least 20 to 30 grams. So the oatmeal is not enough. You got to have add a protein powder to that, add some eggs to that, something that has a high protein. I have no problem with oatmeal, but you got to get some protein in there. That is going to set your insulin response for the day. And it's the number one thing I see patients miss, right? And then we really, from there, we want to try to eat every 4 hours and keep our blood sugar balanced, a protein, a fat, a fiber, and a green, so that we're getting the protein, the fat is satiating us and slowly releasing those carbohydrates and that healthy fiber over the course of 3 to 4 hours, right? That really should be it. And when your hormones are balanced, I want you to be hungry, right? You should be hungry in the morning. And that's a good sign that you're hungry in the morning. So, you want to aim for a balanced meal. Again, protein allows for the signals to the brain to say that you are full, right? So I always tell people, if you're looking at your plate, eat your protein first, get that in, then the greens, and then the carbs, right? It increases the production of GLP-1, which is going to be important when we talk about some of the other options. And this controls our ability to be satiated, to be full, right? Fat, this helps reduce those fasting insulin levels and does a slow burn to our blood sugar levels, so it kind of helps us be sustained. Again, increases satiety, slows digestion, and it curbs cravings. So we're not eating enough, we're not eating the right things or at the right time, and so these are, again, modifiable things that will work with you on to help. So, what are some of the new weight loss therapies? This is what spun this idea to do this talk, is because I'm hearing a lot of people talk about these things, and I want to clear some things up. So you've probably already heard of semaglutide. This is Wegovy or Ozempic, and these are actually FDA approved back in 2021 for diabetes, right? So these are for patients with type 2 diabetes. So the difficulty with this is that for insurance to cover these semaglutide products like Wegovy or Ozempic, you may have or also heard of Mounjaro. That's a different kind of GLP-1, but that's another one that people are using. You have to meet a certain criteria. So you have to have a BMI over 40, or a BMI over 37 with two comorbidities. So, kind of back to those metabolic things we talked about: high blood pressure, insulin resistance, elevated cholesterol, some of those things that you have to have. If you don't meet these criteria, insurance won't cover it, and it can be upwards of $1,200. So, I hear a lot of patients that are trying to go on it. And they're getting these claims denied because it's made for diabetic patients. But the nice thing is there is a way around that, and that's one of the things we'll talk about today. So, what is it? Well, it is a GLP-1 analog, so a glucagon-like peptide. It is a peptide hormone that's produced in the small intestine, and it essentially stimulates insulin secretion, like we just talked about, and it inhibits glycagon secretion, so the glucose, right? That stored glucose. What it does, or what it causes in the body, is a slowing of the gastric emptying. So basically, this causes us to feel fuller and to regulate our appetite. So, one of the biggest things I hear with patients is just the inability to get full, or just always feeling hungry, can't being able to control their impulses or stop eating. And this does a really good job of that. So, a couple really well published journals like the New England Journal of Medicine, and the Journal of American Medical Association, they have shown that semaglutide can reduce appetite. It can regulate glucose levels, reduce food cravings, and result in a total of 15% loss of total body weight. Some of the studies were double that. So it depends, how much weight you need to lose. And again, it was improved in 2021. So it has been a very powerful and effective drug, but it doesn't come without its side effects. So one of the biggest things I ask patients when they say that they're going to go on it, I said, "What is your doctor's plan to get you off of it?" And they stare at me like deer in the headlights. They have no idea what I'm talking about. Because if you don't have a plan to get off of it, it's like any other thing, you will rebound. So we have to make sure when you're ready to come off of it, we have looked at your hormones, they are balanced, you're supportive, we know what your body needs, and you can titrate off of it. So we don't want you paying $1,200 for just the product, right? So we do have a way around that. And that is where compound pharmacies come in. Compound pharmacies allow us to get some of these medications for an off label use, right? So we're able to compound them and get these medications to you that are very effective because sometimes hormones are balanced and we're eating all the right things and the thyroid is balanced and we still can't lose weight, right? And sometimes for men and women when they get to a certain age or even not a certain age, they need a jump start. And this is where therapies like this come in, but they need to be watched and they need to be controlled. So, our program, we start with that week long detox. No one's getting around that. If you're coming in, you're doing the detox. And then we look at making sure we're supporting adrenal glands, nutrient deficiencies with supplementations. And we utilize a combination of semaglutide and another peptide called BPC 157. The reason why is Ozempic and Wegovy can make you very nauseous. Some patients, they struggle a lot with nausea. It also makes you very sensitive to bad food. So if you're trying to eat McDonald's and other things like that, I'm going to tell you you're going to get sick. It is not that easy to tolerate. So it does a really good job of changing your cravings and your taste buds of what you're used to eating. So with that can come a lot of nausea. So BPC 157, it's known to support wound generation and gut healing. So it helps minimize some of the GI upset. So this is an injectable. We are working with our compound pharmacy to make an oral tablet or a sublingual tablet, hopefully in the new year. We don't have it yet, but we're hoping to. But it's a once a week injection, and you're working with an individual provider, and we titrate your dose based on what you need. So there are patients of all different ranges of what they're looking to lose. So we titrate based on that every month. And some patients don't ever get up to the full dose because they don't need it. Right. So with compound pharmacies, it's very easily adjusted to you, which is the whole point of compound pharmacies. So we do monthly check-ins with a nurse practitioner. You work on a customized diet plan. We help talk to you about your struggles and what we can do to set you up for success when you come off of it. And then at the 6 month mark, because typically you stay on these medicines for at least 6 months and then titrate off, we recheck hormones and we make sure that everything is balanced and you're ready to start to titrate off. So that's one of the biggest problems I see is there's no plan of exit, and you got to have an exit plan when it comes to these kind of things because we don't want a quick fix. We want sustainable weight loss that is going to get you guys to where you want to be. So, if you're interested in learning more about our program, take a picture of this. Nicole, that you heard from earlier, who has a voice of an angel, this is her email, and this is our office phone that will go directly to her. So she answers these during normal business hours. You can send her an email there. You can also connect with her on our website, but that takes a little bit longer. So the more direct way is our email and the cell phone number that you can message her on. So take a picture of that. We will make sure we send